In this video, we're going to look at torch viruses and how they affect pediatric populations. TORCH is an acronym. It stands for toxoplasmosis, other, rubella, cytomegalovirus, aka CMV, and herpes infections. The list of other keeps growing, but historically has contained infections caused by syphilis, varicella zoster, which is the virus that causes chickenpox and shingles, parvovirus, and HIV. More recently, Zika has commonly been included in that list as well. So torch infections, or the torch complex, or torch syndrome, which are all terms used interchangeably, are referred to as vertically transmitted infections. In other words, they are infections caused by pathogens like viruses or bacteria that can be passed from mother to child during pregnancy or childbirth. These infections can cause a lot of problems with the fetus. Everything from congenital symptoms characterized by a variety of CNS, growth, cognitive, visual, and auditory deficits to fetal loss. Let's talk about each infection one by one. Toxoplasmosis is a disease caused by a parasite named Toxoplasma gondii. We can ingest it through raw meat, contaminated water, unpasteurized goat milk, and fecal matter of cats. Once ingested by the mother, the parasite can make its way across the placenta and infect the child. Congenital toxoplasmosis is usually not apparent at birth, and about 70 to 90% of infants develop the serious clinical illness in adulthood. Toxoplasmosis is pretty rare. It occurs in 10 to 33 out of 100,000 live births in the US. An estimated 400 to 4,000 cases of congenital toxoplasmosis occur each year in the United States. Of the 750 deaths attributed to toxoplasmosis each year, 375 are believed to be caused by eating contaminated meat, making toxoplasmosis the third leading cause of foodborne deaths in this country. The other category covers a growing number of viruses. The ones that cause the most concern in recent years are syphilis, HIV, and Zika, so we will focus on those. Syphilis and HIV are both typically sexually transmitted diseases, though HIV can also be contracted through transfer of blood, like with Sheriam needles. Syphilis is a bacterial infection caused by a bacteria called Treponema pallidum, while HIV is a virus. Both can be transmitted from mother to child transplacental, during delivery, or subsequently through breast milk. Zika, on the other hand, is contracted through mosquitoes, mainly in tropical regions, and passed from mother to child during pregnancy. How prevalent are these? Well, most recent data shows syphilis occurred in about 0.9 out of 100,000, or 1,500 cases total, in 2012. HIV affects 162 infants a year, and there were 5,658 symptomatic Zika virus disease cases reported through the end of February. Rubella is a virus. It's not common in the US these days because there is a vaccine for it that is 95% effective. The number of reported cases of rubella in the United States remains low, with a median of 11 cases annually from 2005 to 2011. In fact, the CDC met in 2004 and decided that rubella is no longer an endemic in the United States. When infection does occur, it is transplacental from mother to fetus. Cytomegalovirus is more commonly known as CMV. It is a member of the herpes family of viruses and can be transmitted transplacentally during pregnancy or postnatal via breast milk from the infected mother. CMV occurs in 800 out of 100,000 live births in the United States, or 1 in 150 children. This is the most common of the torch infections. There are several types of herpes, but the subtypes we are talking about here are herpes simplex type 1 and type 2. These viruses are sexually transmitted, and they are really common. In fact, antibodies are detectable in up to 90% of the population worldwide. Most people don't have any symptoms with herpes, but it can cause painful ulcerations on infected areas. Herpes is transmitted through direct contact. The genitals are the most common site of ulcers, and this is how the virus is passed from mother to child. Herpes in children can lead to more serious conditions like herpetic whitlow, which can cause painful lesions on the oral and pharyngeal mucosa of children, blisters on the fingers, and inflammation of the lymph nodes. There are some similarities between the clinical signs and symptoms found with the torch infections. Hepatosplenomegaly, or enlargement of the liver and spleen, is common among all infections. Petechia, which are small skin lesions, are common throughout, and so is chorioretinitis, an inflammation of the choroid and retinas in the eye. Other clinical findings that are common in most torch infections are cardiac lesions like myocarditis, hydrocephalus, microcephaly, intracranial calcifications, and hearing deficits, along with other symptoms like fever, nasal discharge, rash, fatigue, etc. Torch infections can be diagnosed by torch panel tests of the blood, urine, and spinal fluid. These tests are used to check for antibodies. Ultrasound, or a CT scan, is used to test for brain calcification. Amniocentesis, or chronic villus sampling, can assist in confirming infections with rubella virus, CMV, B19V, Zika virus, varicella, and possibly herpes. Review of the maternal history is important, which could potentially include a liver function test, ophthalmologic evaluation, audiologic evaluation, neuroimaging, and lumbar puncture. The prognosis is different for each infection and depends on the timing of transmission. The impairments for torch infections are irreversible, so the patient will deal with periods of active symptoms throughout their lifetime. Impairments for torch infections are widespread and potentially include headaches, altered mental status, seizures, focal neurologic deficits, visual loss, visual auditory impairments, abnormal tone, and muscle weakness. They also include the inability to stand statically and dynamic balance. Children with torch infections have potential activity and participation limitations that include the inability to sit, roll, crawl, and creep, ambulation problems like gait deviations. This depends on muscle tone. Decreased ability to feed, clothe, and bathe. Decreased ability to play and focus in school. Physical therapists use a variety of different outcome measures for individuals with torch infections, depending on the impairments discussed above. A few of the most prevalent include Alberta Infant Motor Scale, the Peabody Scale of Motor Development, and the PD. Treatment for torch infections has been limited historically. We are currently using antivirals with success in select cases. There is no treatment for many infections other than supportive care, like hydration and acetaminophen for fever reduction. If primary or recurrent herpes genital infection occurs late in pregnancy, elective cesarean section delivery is performed to prevent neonatal infection, although neonatal infection is still possible. For toxoplasmosis, after early detection, the mother can be treated with spiromycin, which is an antibiotic, to prevent fetal infection. If the fetus is found to be infected, a cocktail of medications along with folic acid supplement has been found to be effective. Syphilis can be treated with antibiotics including penicillin, but some signs of congenital syphilis are permanent. So what can we do as PTs? Well, the preferred practice pattern for physical therapists to treat impaired motor function and sensory integrity associated with non-progressive disorders of the central nervous system that are congenital in origin or acquired in infancy or childhood is developmental activities to facilitate normal movement patterns and acquisition of motor milestones, minimal impact of visual and auditory deficits on motor skill acquisition, therapeutic exercise, including strengthening, functional activities, transfers, gait training, and stair climbing. Vertically transmitted infections such as torch can have lifetime impacts on the lives of newborns. Unfortunately, we do not have a cure for the majority of these infections. Therefore, as physical therapists, we should focus on prevention and treatment of impairments. Keep in mind, this video is a broad overview of the impacts of torch infections and its effects on the families exposed to it. Please visit these helpful sites for more information.